Joining us now, former press secretary to House Speakers Paul Ryan and John Boehner, Brendan Buck, and former Republican governor of Ohio, John Kasich, is with me. Both are MSNBC political analysts. Also with us, anchor and correspondent for Bloomberg News, David Gura. David, I'm going to begin with you on the bill, on the numbers. Americans don't like it. It's going to kick a lot of people off Medicaid. The Republicans say this is just work requirements. So anybody who's qualified for this should be able to stay on it. But they are budgeting for a lot of people to be kicked off of it in order to pay for these tax cuts.
Yeah, a sizable increase to debt and deficit. And, something that was missing over the course of all of this debate was really a considered conversation about what the ramifications of this are going to be. That's by virtue of the fact that this was kind of a plastic thing as it moved from the House to the Senate. And I think many people who voted for it weren't able to make it through those 1,000 pages before they did. So I think we're going to see here over these next weeks and months, people reckoning with the fact that there are very real world implications to what was in there. And I think the Medicaid cuts are going to be the most evident to a lot of people. We've already seen hospitals announce that they're going to close, beginning to close. So that's going to have a huge real world effect. And then this, what you brought up, the fact that it's adding so much here to debts and deficits runs in the face of what we've heard from Republicans for so many years.
So it's not going to, these work requirements aren't going to take effect until after the next midterm. So there is a delay here. But that doesn't mean that hospital systems aren't going to start budgeting for the reality of this bill now, right?
That's exactly right. I mean, they're going through this, again, figuring all of this out, but that is happening in real terms.
So the changes are going to begin.
Changes are going to begin. And this notion that there are so many people in this country, to the tune of millions, who were flouting these benefits, not using them properly, would not meet these work requirements, has yet to be borne out in any sort of factual basis. So, again, that's kind of a fallacy of what we've seen here.
Governor, what's interesting is there's polling on this bill, and as often as we say Americans aren't paying attention to the nitty-gritty of what's happening in Congress, the ones that are paying attention to what's happening right now are very clear in how they feel about it. They don't like it. We can show you polling. We can put it up on the screen. Every single poll that's been taken on this shows that Republicans on this bill are underwater. People don't like it. They don't want it. Explain to me why the Republican Party still pushed ahead with it.
Well, first of all, let's talk about the tax cuts. I mean, there were some tax cuts added that I didn't think were wise to add, but continuing the tax cuts that had been enacted were critical for the economy to continue to grow. In terms of Medicaid, my biggest disappointment on the Medicaid program, and by the way, for the first couple years, it is work requirements that you have to sign up. They will check you in 6 months. Now, it'll be up to the states to make that process fluid so that people don't get off the rolls. But, I think where the Republicans have a problem is the Democrats have already labeled it a bill that takes health care away. And I think that's really, really tough to counter. What the Republicans have to hope for is that there is an improvement in the economy. They have to be able to point to the fact that people are better off with the enactment of that bill than they would have been had it not been enacted. So, I mean, they have a tall order. And look, whether this bill is popular or not, my judgment is the Democrats are going to win the House in the midterm elections. With the changes that are happening in the Senate, it is unlikely they would win the Senate, but not impossible. But in the House, to me, it's just a matter of the total number of seats that Democrats win. And they're going to hear about this bill. Republicans are going to hear about this bill all the way through, being told that, what they did is they cut health care, tax cuts for the rich, and at the same time, the debt went up. And that's tough to counter. There's ways to do it, but it's not going to be easy.
Well, can I quibble with you on one of those points? You're saying Democrats are labeling it as a cut to health care, but it's just work requirements and states are going to have to figure it out.
No, in the first 2 years.
But Republicans are budgeting for people to be kicked off Medicaid. They're budgeting for a savings on Medicaid. That's how they're using it to pay for the tax cuts. So they are budgeting for people to no longer have access for Medicaid.
Well, you can quibble with me anytime you want to, Katie. A quibble's always a good thing. What they anticipate is that some people are on the rolls who will not be on the rolls because they don't qualify. And look, the reason why they're saying people will be off is because they're not sure that people will reapply. That's what they're concerned about. It's always was a concern I had when there was too many things that got in the way of people getting health care. But I think that's why they assume that. Now, that doesn't mean that the whole Medicaid business is done, because later, they've taken away a certain gimmick that the providers have used to bring in money. That is being cut back. And it will then be up to states to try to figure out how to deal with less money. Can they be creative? I think they can be creative. Will they be? I don't know. When I was governor, we took Medicaid from 10% to 4.5% when I was in, to now it's at 12%, and I expanded the program. There are ways to do this. And finally, as you know, Katie, we can't continue to just spend all this money. There has to be reform. But in health care, we don't see any reform in here. We just see some cuts. We don't see reform to try to treat people to keep them healthy. And so it was just, sort of an exercise in trying to make numbers add up. But we need a more fundamental reform in the whole healthcare system, Medicaid, Medicare, and the private system.
My friend Abby Phillips on another network had a moment that took off online, where she asked one of her panelists, who was saying that people are going to have to make sacrifices for this bill when the rich are going to make sacrifices. You're talking about tax cuts, Governor. Why, if we need to get our fiscal house in order, why continue to push for more tax cuts for people who can afford to pay?
Well, Katie, first of all, I don't agree with some of these tax cuts that are in there, the tax on tips and not tax on Social Security and all that. But the way in which you get financial stability and security is you do two things. You reduce spending and you also grow the economy. If those tax cuts went away, that economy would shrink. Look, I was there when we balanced the budget. We did two things. We reformed the social programs. We saved money, and at the same time, we reduced taxes, particularly the capital gains taxes, and we had a surplus and strong economic growth and paid down the largest amount of the publicly held debt in American history. So it takes two things. What I'm disappointed in is they did not undertake a fundamental reform of the healthcare system, treating people to be healthy and incentives to treat them to be healthy, as opposed to the same old come in, get another test, and another thing here, without changing the trajectory of the system.
All right, Brendan, I was saving you for a reason. You worked under the man we played at the top of this hour, John Boehner. Do the Democrats have a John Boehner on this issue? Somebody who can come out and whip up the House the way that he did, whip up the public the way he did?
I mean, certainly Hakeem Jeffries tried. I mean, that was certainly a highlight reel speech for us in the Boehner land, and I appreciate you showing it. Hakeem Jeffries, I think, needed a moment like that, and certainly speaking for nearly 9 hours maybe provided that. Like, I don't think whatever floor speech the minority leader gives is really what's going to set the political course for this. Now it's just the hand-to-hand combat of politics in district by district. And are Democrats going to make Republicans wear this bill as a healthcare bill? I mean, let's remember, this was intended to be a tax bill, right? This started off as a tax policy exercise, and it ended up becoming a healthcare conversation, and one that they certainly didn't prepare the country for. There was no explanation of why we're taking on Medicaid and why this is necessary. What we ended up with was just, as we've discussed before, trying to find an offset. And members who were even voting for it didn't really understand what the Medicaid policy changes were. So it's just really sloppy policymaking. I think the politics are pretty bad. But Republicans have an argument to make about work requirements. Those are relatively popular if you frame it around work requirements. I just think there's a lot more to it than that, and it's going to be a lot more cumbersome than perhaps they're making it out. I mean, they were denying they were even touching Medicaid for a long time and just kept using the words waste, fraud, and abuse. Ultimately, that's going to catch up to you, and I think it probably will for a lot of swing seat members.
All right. We're going to leave this conversation here, but we're going to continue on to some really good ones. So, gentlemen, thank you so much. Appreciate it. Thanks for starting us off. Brendan, thank you for waiting patiently for me. I appreciate it.